Good afternoon. I'm George Latimer, Westchester County Executive. I'm joined here by our Commissioner of Health, Dr. Charlita Amler, our Commissioner Sheriff of the Department of Public Safety, Tom Gleason, the head of Commissioner of our Department of Emergency Services, John Cullen, and Dennis Del Borgo, who's a senior executive in that department as well. We have with us other members of our administrative staff. We're here today to prove that people have to admit when they've done something stupid. And I have done something stupid. As a 66-year-old man here in February, I have failed to get a flu shot, which I should have done months ago, as way back as November. I had ample opportunity. I've got a few excuses, but this being Ash Wednesday, this is not a day to use excuses. This is a day to correct your faults and error. And so we're here in one part for me to do something that we encourage everyone to do, even this late in the season, in getting a flu shot. But it also comes at a time of great consternation over what is happening with the coronavirus and its degree of spreading. And the press interest is less about me getting my personal flu shot than what is happening here in this area relative to dealing with this issue and what could yet happen. I'm going to say a little bit about our overall philosophy. Dr. Amler is going to address those issues from a scientific standpoint, medical standpoint. Then I'm going to get my, we'll take questions after that, I guess, to delay the moment of the needle. And then we'll try to answer any of your questions, and then I'll get the flu shot that I so richly deserve. It's very important for us to strike the correct tone. And the correct tone is somewhere in between things that I have seen and read about or heard. On one extreme, people are extremely nervous and frightened about the spread of coronavirus. There are statistics around the world that are deeply concerning about the number of people infected and the number of deaths that occur, certainly in China, and now that there are a number of other countries that are affected. And on one side of the continuum, this is a moment at which people may go on the internet and find reasons to be not just concerned, but to overreact and to take sort of a world is coming to an end situation. At the other end of the spectrum, the data of what's happened here in our immediate area is not at this point of a size and scope to be worrisome, and therefore you're having people who will say there is no problem, don't worry about it, you can relax, business as usual. The truth, as always, is somewhere in between. We're prudent people, and we have to take prudent action, but we also have to be measured and controlled in the way we respond to these things. I'm standing with people who have spent their life as professionals doing very difficult things. John Cullen is by profession a firefighter. He has gone into burning buildings. Tom Gleason is by profession a law enforcement officer. He has done patrol where he has pulled over a car and walked up to the windshield of a car to address a driver, not knowing what that driver's intent was. Charlita Amler is a medical professional, medical doctor. She's had years of experience in public health, and she has dealt with diagnosing individual problems of individual patients, pediatrician, that have come before her. In each of their cases, Dennis as well, they've shown professional knowledge and experience, and they know when to calibrate their response depending on what the situation is. Tom doesn't walk with gun drawn. There's a time and a point at which his training tells him that he needs to be prepared to defend himself. And that is exactly what we need to have in the body politic right now. We need to not be so assured that there's nothing to worry about at all, and we need to be sure that we haven't gone to the other extreme where we overreact and we let conspiracy theories drive us into a position of panic. Where we are right now with the coronavirus in Westchester County, there are still 8 individuals, that number is up from yesterday, there are 8 individuals that are under quarantine, and they are being observed over the incubation period of time to determine if they have the disease. They may have been exposed to the disease, and because we want to err on the side of caution, that triggers the quarantine. They are not in isolation. Isolation comes if they are seen as having the disease and have been tested positive for the disease. Quarantine is to try to make sure that their contact with other people, if they wind up having the disease, doesn't spread the disease. And so far in all of the cases that we have had Westchester residents who've been cooperative, who've been willing to be quarantined, in most cases in their home, although we have, at least in one instance, set up a separate place for a person to be quarantined in. The numbers have been manageable. At our peak, we had 26 people, And once they have gone through the 14-day incubation period and have evidenced no sign, they're asymptomatic, no sign of the disease, then they've been allowed to continue on with their normal life. Any of us can imagine what it would be to take 14 days out of your life and stay home all the time. It sounds good for the first day, and then at some point in time you're stir crazy, and plus you have responsibilities that you want to meet. But our professionals, which include our law enforcement and emergency services professionals, have made sure that these people could be in a quarantine situation and still function in their life, the provisions they need and so forth. So we now still have 8 people under quarantine. That number's up because there are additional people that may have been exposed. At this point, not only are there no cases, confirmed cases of coronavirus in Westchester County, there are no confirmed cases in the state of New York. 15 cases over the stretch of the United States of America. Over the whole country, 15 cases. Now, that is much less than you're seeing in other countries of the world. The CDC is responsible for the initial response as a nation, the original plan to interdict those who came in from China specifically, since this is where the outbreak began. Now we see that the outbreak has spread to other countries, and we look for the professionals at the CDC to advise those of us in other levels of government as how best to respond to this. And New York State Department of Health has a superior authority over the county. They will give directives which we will have to implement, and our professionals, Dr. Amler and her staff, because she has other medical professionals, medical doctors, prepared and educated nurses who know how to respond to these things, they dialogue with the state health department, and then the discussion of how we implement those things are happening. In the longer run, we are preparing contingency actions for whatever may come. Those contingencies involved all of the departments of county government. We're joined as a visitor here today with our Commissioner of Parks and Recreation, Kathy O'Connor. She runs one of the more widespread departments that involves public contact in over 50 facilities, including the one we're in, the county center. We are making contingency plans should circumstances become worse. And if they do become worse, we will not be sitting around going, oh, what comes next? We'll be prepared to go to what's next. But we're not going to frighten the public by coming up with the worst case scenario today, because we're not near the worst case scenario. But be advised, we are planning for what the worst case scenario would be. And in the case of Kathy's department, she has a series of summertime ethnic festivals that are marvelous. We have Playland on the rebound. We have public pools and golf courses. Whatever plans we make will cover all of our different county functions and structures. And they won't be made by politicians. They'll be made by professionals. And we will tap the knowledge that John and Dennis and Tom and Charlita and their teams have as we make this decision. So I'm talking to the people of Westchester County very simply. This is a county with many intelligent people. They have successfully charted their lives and their careers. They don't do it on emotion. They do it on reason and fact. And the reason and fact of where we are today is that we have just as much threat from influenza and its spread in each year as we do for this particular virus. But we do not underestimate the potential of this virus to morph. We do not underestimate the fact that this virus may yet become a pandemic, but we won't be the ones to make that decision. The senior people in the nation and in the state will make those decisions, and then we will respond intelligently and move forward. I say all of that to say this. Even intelligent people can do stupid things. I have done a stupid thing by not having my flu shot. So I'm going to do the right thing today, and that's what I encourage you to do. In a few minutes, Charlita will go over some things that seem common sense, how you wash your hands, et cetera, et cetera. They're common sense things. But intelligent people don't always do what's common sense. So I am, on this day, which has a unique experience in my religious tradition, I'm going to do what I should have done, and that's what we urge everybody in Westchester to do. Do what you know you should do. We will get through this, as we've gotten through every other crisis we've had. Use common sense, be reasoned, and if this situation becomes worse, we will respond effectively to whatever happens. And if the situation is resolved at a reasonable amount of time, we'll share that good news with you too. We won't do it prematurely, but we'll do it at the appropriate time. So next, I'd like Dr. Charlita Amler to share her thoughts as our Commissioner of Public Health.
So good afternoon. So if you've been reading or listening to the news reports on coronavirus yesterday, that information could be quite alarming to the public. So we're here today to just let you know what Westchester residents should do, and the most important thing they should do is stay informed. We want them to keep track of what's going on with this virus, be vigilant, but mostly we want them to stay calm. Coronavirus now is in 39 countries, with the largest numbers of cases still being in China. Within the United States, we have been very consistent. The case numbers are actually 14. Initially, it was reported as 15, but the corrected number is 14 confirmed cases and 39 people who have been repatriated to the United States, meaning they were abroad, they became ill, and they've been returned home. With the coronavirus spreading globally, CDC has issued some travel notices, and to date, Westchester County residents are being advised to avoid non-essential travel to both China and now to South Korea. And that's given the number of cases that have occurred in these countries. Older residents and those with chronic medical conditions should consider also avoiding travel to Iran, Japan, and Italy. And before making travel plans, I would really encourage residents to visit the CDC website, which is cdc.gov, as they have information concerning where in the world this virus is currently, the number of cases that are currently being reported. So the county departments, including the health department and emergency services, we continue to participate in state and federal briefings to receive additional updated information and the latest guidance for healthcare personnel and for monitoring persons potentially exposed. The county is in communication with our local hospitals, our healthcare providers, and we are monitoring the supply of personal protective equipment, and our county does stand ready to assist facilities that need help obtaining supplies. The county is reviewing its emergency response plan and is prepared to implement strategies should the need arise that would lessen exposure to residents. The county health department continues to follow state and federal guidance on the monitoring of persons who have been exposed. And at this time, federal and state authorities are not requiring persons returning from South Korea to be placed under quarantine orders or to be restricted from school or work. The county continues to send updates to medical providers and first responders as new information is obtained. And the health department has a coronavirus webpage, as does the New York State Department of Health. And they also have, the state health department also has a coronavirus hotline. So what can residents do? Well, I think the first thing, as you've heard, is stay calm. We want you to stay informed. Pay attention to what the news is saying. Go to the CDC website, read for yourself so that you can be better informed and know what may be coming next. We want to remind people the things that we've reminded them of many times, that washing your hands is still the best way to stay healthy. If you're sick, stay home. And that's even if you're mildly sick with a respiratory infection, we would encourage you not to expose others to your illness. Cover your mouth. We've talked about that before, how you can use your elbow to cough into or sneeze into. If you use tissue, to please dispose of those right away. Don't leave them on a surface where other people might then become exposed to your secretions. This is not a time for green cleaners. We've said that before, but bleach really is important. And when we have influenza and other respiratory infections, so at home, it's a really good idea to use bleach, allow for contact time, don't wipe it off. And the last thing, which the county executive is going to do shortly, is get your flu shot. So I think that that's pretty much what I'd like to say. I think that we do get calls from people who are concerned, and we are trying to respond to those calls as quickly as possible. And I think that that's pretty much it for me.
Thank you, Dr. Amler. Thank you. We've been joined by our Deputy County Executive, Ken Jenkins, who had his flu shot in November. Some of us don't need a memo sent to them, I guess. And other members of our executive team are here as well. We'll open it up to questions. And then if you want to stick around and get the visual of the flu shot, you're welcome to do that. And if you need a flu shot yourself, just, raise your, okay, guess not. I don't mean to make light of it. Nikita.
I just want to make this clear. So 26 people were in quarantine. That was the peak.
That was the peak amount total.
And now there's 8.
Now there's 8.
And you said that number went up?
It went up by 4 in the last day.
Yeah, yesterday it was 4. The number changes because, again, people are in there for 4. I'm sorry. So as people arrive and are identified as needing to be placed into quarantine, the amount of time that they may need it varies because it's from the time that they left mainland China or had an exposure. So that's 14 days. But they could have went to another part of the country, of the world, rather, and come into the United States, and they may have not been in China for the last 7 days. So their quarantine would be 7 days and not 14 days. And so yesterday we had 4 people under quarantine. We get reports of people flying in, on a daily basis, and we do reach out to them, have a conversation, make a decision whether or not they'll need to be placed in quarantine. But currently we have 8.
And those 8 people are not confirmed positive and don't show any symptoms yet. This is just a protocol.
That's correct. So we would not place an ill person in quarantine. Quarantine is really people who've just been exposed or have a travel history. So those people are healthy. No, we have no one ill in the county. We've had no cases. So I think, we're going to all take a deep breath for the moment that there's no cases in New York, no cases in Westchester, and we're just monitoring people who have travel history.
And is China the only place so far? And I know you mentioned South Korea, you said people aren't being quarantined from there.
The CDC has not changed their protocol as to who we have to isolate related to travel. Currently, that's just China. However, the federal government has placed South Korea on a travel alert, grade 3 travel alert, which says to people in the United States, don't go there unless you really have to, because there are cases in South Korea.
What about Iran and Italy? I think those numbers have spiked a lot.
They have. They're not yet on a level 3 travel alert. Their travel alert is it's a level 2. So they're saying older individuals, because that's the people that are being most impacted by this disease, most likely to have a bad outcome, most likely to die if they were to get the infection, are people over the age of 50 with chronic medical conditions. So for those individuals, they're saying consider not traveling to those countries if you are older and have underlying medical conditions. That might put you at risk.
Other questions from any of our friends in the press? Yes, Martin.
You mentioned about certain precautions that are being taken or preparations that are being taken. Can you go into any further detail?
Well, the task before each of the departments of county government, obviously it starts with our public health professionals, but every department of county government will look at and develop some contingency plans of what to do were this to expand. Some of our departments, might have less of an impact on it. Department of Environmental Facilities, which doesn't really have a public contact piece to it. A couple of things, a couple of recycling days, but by and large, is an interior department would have less of a concern about it. For any operating department, they would look at what would happen in a more severe situation, as to workers who could work at home, telecommute, if you will. That would be part of what their planning would be. Some of our departments would have much more serious efforts. I mentioned before the impact of Parks and Recreation, which is arguably the department of county government that has the most amount of public contact. But it would be true that every department would have some responsibility contingency plan. And, what we'll look for is the metrics that come out of the federal government as to where we are. Should the thing become worse at some level, then some other higher level, then some further level, then we would take additional steps to do things. We know that the virus is contagious, highly contagious, but there are relatively close quarters in which that contagion happens. So that would make us look at the kind of activities and events that the county sponsors, where we have activities and events that we can postpone. There may be a board and commission that could be done by teleconference effectively. We'd use that strategy. We haven't yet reached the warmer weather, and when the warm weather comes, we have many more public events that are outdoors and involve a lot of people. We haven't reached a point of criticality where we have to consider whether or not to to do those things. And we're going to look at what happens in the world around us. We know that right now they're making an assessment about whether or not they're going to have the Summer Olympics in Tokyo this year. And they will make, they're in a different country with a different set of concerns in Japan, but we're going to look and see what happens around us. Major League Sports will take some action, and then we'll determine what we do with the sponsorship that we have at the high school level that happen at our facilities. So all of those things are yet to be discussed, but the important thing is that contingency planning is in the stages of occurring in every department of county government. Every commissioner knows that they have to now sit down and say, what do I do in this context? How do I protect my people on patrol? How do I protect the people that are patrolling the streets of Mount Kisco or have a function in Cortland or Tuckahoe? And that department will determine how best to deal with that. Joan McDonald, who's our Director of Operations, Emily Saltzman, our Deputy Director of Operations, pull those things together in a cohesive fashion. But in most of those cases, Martin, what we're going to look for, first and foremost, is what is the degree of the spread of the disease at that point in time that we're discussing it? At what point does it reach another level that requires us to be at a different level? And we're going to rely very heavily on our health department professionals to help us make those assessments so that what we do is reasonable and effective at that level. And it's important to say that because we want to avoid what I've seen already on the internet, which is wild speculation, people asking questions that will trigger a doubt factor. I saw one person say today, how do we know 14 days is the incubation period? What happens if it's 21? You're talking about non-professionals who are afraid, and they're calculating things that will send people into a frenzy. And we have to stop. And we have to look back at what professionals advise us on these things. But we are doing contingency planning. And I might add that some of those contingency plans we would not release to the public until we reach the point at which they're needed, because it would only frighten people to hear that, we're going to DEF CON, whatever the highest level of DEF CON is. But I also think it's important to know that we are not taking this for granted. We are not assuming everything is copacetic and it will automatically stay the way it will. So it is what it is today, and we're prepared for what it might be tomorrow. Any other questions? The more questions you have, the longer you delay me. If there are no other questions, you're certainly welcome to interview any of our folks here with a one-on-one for any further details. And if there's no other delay between me and it, I should get to it. So, John, say something to make me focus on you. What's going on here? Yeah. Yeah, I'm ready.
That's it.
Oh, geez, that's nothing.
Maybe you should give him a sticker.